So regarding anesthesia, there is a continuum. And on one end, you are completely awake, and we would just administer local. So we would just do injections and then do a procedure. On the other end, you are completely asleep. There's a machine that's doing breathing for you. You're on the IV and everything else, and that's complete general. All along this continuum is where anesthesia is. Most of the bigger procedures we do, they're on this end. You're completely asleep. You don't feel anything. You won't remember anything. If we're doing a little eyelid procedure or a small thing, we may just inject some local anesthesia and just do a nip and tuck.
We also will pay attention to what the patient has told us about how they have reacted. If they say, I always tend to have nausea, well, we're going to give them everything possible to decrease the chances of having any kind of nausea post-operatively. So it's a very individual process on how each person reacts.
We want you to be very comfortable, and we want it to be painless, and we want the process to be easy for you. And so usually that means general anesthesia.
It's a very, very safe place to have surgery. The anesthesia providers are fabulous. They've been doing this forever.
They get enough anesthesia to be made comfortable, to go to sleep. If someone were to start to feel uncomfortable during the procedure, what would happen is their heart rate would start to come up. They would start to breathe more. There are signs that tells anesthesia, okay, this person's starting to get a little bit light. In that case, they can now address it and give people a little bit more medication to bring them back down to that comfort level.
You know, anesthesia is safe. We do it every day, and I would let any of my anesthetists put me to sleep. I actually think that we can do a better job as surgeons with general anesthesia. And if I'm worried about your comfort, I'm not focused on how good of a result I can get.
Patients don't remember the procedure. Patients just sleep. Procedure happens. Patients wake up. They're usually happy, and then they go home.